Dear fish keeper, today again about Oranda lionheads, a very popular fish. In my case, 109. Yes, we are making progress. 109 cases already discussing the problems we encounter in fish diseases. So I will show you my findings with the help of my PowerPoint. In this case, 109 is an Oranda lionhead redcap with tubercles. And the tubercles most likely are caused by Mycobacterium, which is also called fish tuberculosis. Here you see the redcaps Oranda suffering. They are hanging at the surface. Some are doing very well, not showing any specific signs, but it's always a very few that die, or look at this one who is dead. But you see the ones separating from the group, and some are getting bloated, getting dropsy, some getting skinny, many different signs to express this disease. But important that you do a good examination and examine the gill tissue, the skin, and the internal organs. And that's what we did to find what was going on in this group of redcap orandas. And here, like this picture shows, very badly damaged gills due to bacterial infection. And you see also the bloody, bleeding, hemorrhagic lesions in the gills. Might be caused, in this case, like our findings will show, by a bacterial infection. So that's why the fish will, of course, die from suffocation, from very pneumonia gills, infected gills that are not working properly. And the main thing we found was internally that the organs like the liver and the spleen had a big load of tubercles. And not much healthy tissue was left of the spleen or here of the liver. Here we show again the liver with many tubercles taken away, healthy liver tissue, and those are encapsulated colonies of bacteria. Here, look at this head kidney. The head kidney had hardly any healthy tissue left. And that's why the gills getting very stressed, because the gills take over the activity of the kidneys. So they have to be more active in excreting also the urea and the ammonia. See here, that's the other kidney, the main kidney, also having a massive load of tubercles. So, well, yes, you have to inform the supplier that this breeder is doing a bad job in breeding this kind of redcap lionheads. The bad fish should be removed and put to sleep, because they will not be cured by any treatment. You can use Narcomor Plus from Aquarium Münster. And maybe some of the fish are less affected, and they could survive for a long time. Yes, we see that happening. They can survive for weeks or years even. So we don't know, because you don't see what's happening internally. Ask your fish doctor for a trial with an anti-Mycobacterium medication. There are some that people tried, but the results, in my experience, are usually very poor. The best thing is to take good care, good water quality, good food. And we recommend to feed with our Dr. BASSLEER BIOFISH FOOD FUCO, because the fucoidone, which is used here in that functional food, helps the fish in coping with a bacterial infection and in surviving. And at least feed it for several months. And meanwhile, no other food, only this. And you might be more successful with the other Oranda redcaps which are alive. Read my books, which are available in different languages. Here are the 2 English books, where I talk about goldfish and the risks you can have as kind of disease with the goldfish. And become a specialist. Try to follow all my cases on my Patreon channel. Also a specific fish disease diagnosis classes I'm giving there. So maybe it's something for you to become a specialist and to become a good fish keeper and taking care of your fish. Thank you for watching.